Hey guys, Dr. Redcross here. So part 5 of patient-doctor pain points. I have a patient here. The patient says, hey doc, I have a fear of asking too many questions. No. She also goes on to say, if I ask another question, will they think I'm being difficult or wasting their time? That is a resounding no. If you feel that way, once again, we're out of there. You see this. I'm talking about these pain points. There's a lot of me saying to get out of there because I want you guys to all feel like gold when you're in the office with your doctor. So this person had a fear of asking questions or too many questions. And look, you always hear that there's no such thing as a bad question, right? And that's really true because there really isn't. I love when patients ask questions. In fact, you should do the same. And if you feel that you're asking these questions and your doctor is annoyed or sighs or some ridiculousness like that, once again, not a good fit. Look, when patients come in, I've spent decades training, right? So what am I to think, or, that a patient's coming in and knows exactly what I know or why they're having this issue or why they're having this problem? Of course. So one of the things you have to have as a physician is, the ultimate patience, right? And I'm a concierge physician, so I have super duper patience. Believe me, that's for another discussion, another day. But their point is in that when dealing with this patient, you should never have a fear of asking questions. It was the reason why I wrote Bond in the first place, my first book, because it was about the patient-doctor relationship, trust, respect, empathy, and communication. Those are the cornerstones that I think are important. And if you have all those cornerstones, then you shouldn't have a problem asking questions. In fact, I actually like when patients ask questions. Number one, I know that patients are engaged. Number two, this is like this learning, kind of like this learning platform that we got together. I love to teach, but then when the patient, you are also dialed in and you really want to get really deep into what's going on. Oh my gosh, guys, I was thinking about something because, there was a patient that I spoke to just today, and the patient says, well, doc, so there are some bone issues. Once again, this isn't HIPAA, everybody, but she has some bone issues. And so she has to take a medication that is an infusion. Actually, not infusion, I'm sorry. It's one pill once a week. But with that particular pill once a week, she has to take calcium. And so she's an older patient and just was kind of like, look, doc, I'm taking so many meds. I don't even know if I need this calcium thing. I'm annoyed by it. No one told me anything about this. So I said, what do you mean? So the endocrinologist didn't answer your questions or anything. She was like, didn't tell me about it, told my husband, but my husband just didn't want to ask questions about it either. So now here I am in front of a patient who has a very important issue with her bone health, which is important, especially when we're older, because one of the bigger challenges that you have when patients get older is the fact that they fall. Falls lead to fractures, so therefore you want strong bones. So this allowed me to answer her question that she wanted to ask but didn't ask, and it allowed me to do this beautiful teaching moment, right, where I can talk about osteoclast and osteoblast. These are cells, everyone, within our bones. I did a piece on this, everybody, before about medical jargon, so that's why I'm breaking it down into this last organic compound, right? So I'm breaking it down. So the osteoclast, everyone, breaks down bone, and osteoblast builds up bone. So it allowed me to sit down with her eye to eye to talk about how just the blessing and beautifulness of what our bodies are able to do by the Creator. And so then the calcium comes in and helps to build that up with the osteoblast. So I was able to break this down to her. You should have seen her. She lit up. She was so excited to understand about her body. I was excited because I lit up too, because I could explain about her body and just the coolness of the science. I'm kind of a science nerd if you haven't figured that out yet. But I was able to kind of help her understand the bone health. And what is the big impact of all of that? What was the big thing that came out of this? Well, number one, I had an educated patient. Number two, I had an excited patient who was invested in her health. Number three, guess what? Made the doc happy, right? I did what I know I was put on this earth to do. And number four, and not necessarily in that order, well, maybe in that order, but number four, now I have a patient whose risk of fracture is going to plummet because I was able to educate her on the medication that she has once a week and the reason for the calcium. Vitamin D is a part of that too. But the point is, I was able to really like kind of put my arms around the whole situation and almost like a virtual spiritual hug for her to feel comfortable. The big outcome, she's now taking it. She now is okay with it, and she's happy to take it. That's what needs to happen. And that won't happen unless you ask a lot of questions. All right. I hope that helps. Take care, everybody. Dr. Redcross signing off. We'll talk soon. Hey, everybody. Dr. Ken Redcross here. If you don't know, I love the patient-doctor relationship. It is so important. So my question for you is, who wants to live longer? We all do, right? So therefore, I've written 2 books. This first book is called Bond. It's the importance of trust, respect, empathy, and communication with your doctor, because I believe if the relationship is perfect, then it will help you live longer. But how can I really make sure you live longer? Well, I decided to write a second book. This is the 15-minute Bond Blueprint. This particular book helps you go minute by minute of your 15-minute visit to make sure you get the perfect doctor relationship and visit that you all deserve to make sure we extend our healthcare journey.